and you have a quorum present.
Thank you, Madam Clerk. Next item.
B, Chair's remarks.
There are none. Next item.
C, approval of the May 15th, 2024 meeting minutes.
Chair.
Support.
Here, we have a move approval from Commissioner Killeen, supported by Commissioner Clemente. Any discussion on that? All right. Roll call, please.
Commissioner Killeen.
Aye.
Commissioner Clemente.
Yes.
Commissioner Garza.
Yes.
Motion carried.
Thank you, Madam Clerk. Next item, please.
D, unfinished business. There is none listed.
Thank you. Next item, please.
Item 1, under new business, a report on the activities of the Senior Services Department.
Thank you. Come on up and join us and press your microphone.
Good morning. William Chuck Jackson, Department Director, Wayne County Senior Services. I thought that I've been here now. My anniversary was May 30th, so it's been 1 year. So I've had an opportunity to speak to the committee, but more or less on issues related to budget adjustments and things. But so I wanted to take a moment after my anniversary to kind of let you guys know what we've been doing in the department, so that we can hopefully figure out our path forward. So I put together a presentation, and so I'll go through that and try to really highlight for you what we've been doing and what we're trying to do with our department. It's, for those who probably are aware, the Senior Services Department is probably one of the smallest departments, if not the smallest department within Wayne County government. And I think it's a department that has been that goes relatively unnoticed, right? And yet there's a tremendous amount of positive things being done on a daily basis. And so it's one of the things I've been doing in the year that I've been here is trying to tell the story, really to let people know what this department has been doing, what it's doing. And so we hope to begin to change this idea that, the Senior Services Department is sort of this forgotten department within Wayne County. Obviously, I've only been here a year, so there's only so much you can accomplish. But we'll see where we can wind up. So if we can go to the next slide. First, the team. So obviously this is our department. Our department is really only 8 full-time staff. And currently, we're in the process of hiring a position. We have a open position that we're looking to hire for, but we have only these individuals here who work with us on a daily basis. So if you go to the next slide. We also have about 60 part-time employees that work at the various 39 nutrition sites that we have around Western Wayne and Downriver communities, because part of how our process works is we have communities that allow us to use facilities in order to be able to, we call them nutrition sites, where the food is delivered, and the part-time staff manage those sites and help prepare and package the food along with volunteers to see that it gets out to our seniors on a regular basis. You can go to the next slide. So, I'm pretty sure most of you are familiar with our department, but I think it's important to talk about our mission, because I think one of the things that folks don't realize is that we do operate under a mission. I come from the, human service, child welfare, social services sector, having spent more than 30 years there prior to coming to this role. So working in a department that has a mission was very important for me, because I've always had a mission to work from. So, and our mission is not just to feed our seniors and provide them with nutrition, but also to be an advocate for them and to make sure that our department is really speaking on behalf of seniors, in addition to providing the service of nutrition. So we can go to the next one. And of course, these are the communities we serve: Western Wayne, Downriver. So we serve everywhere but Detroit, Highland Park, Hamtramck, Harper Woods, and the Grosse Pointes. We do our work everywhere except those communities.
Up with that.
It says 30. Sorry.
Yeah.
Through the chair, I was wondering why it said 34, not 43. So you answered my question.
Yes.
Thank you.
And we're often confused because people will call us if they're needing services. If they live in Detroit, they'll call our department and vice versa. So that's one of the things we're often explaining to people is even though we're Wayne County Department of Senior Services, we don't actually serve the entire county of Wayne. So those are the communities. You can go to the next slide. So our funding, obviously, most of you should be aware, most of our funding comes through the Senior Alliance, who has been a tremendous partner for our department. We have a unit reimbursement rate, which most of the money obviously comes through state and federal funds through the Area Agency on Aging, which of course is the Senior Alliance. But of course, we do have general fund support from the county. So thank you and the commission for supporting us with general fund dollars. And then we also have donations from clients, family members, and also we have, there's an organization called Scan Wayne that has adopted our department and has been doing fundraisers to raise funds for our department. So, and then we've had the benefit of additional ARPA funds over the last couple of years. But of course, the ARPA funds are running out, I think. But we've been thankful for those resources. So that's our funding. We can go to the next slide. So obviously, one of the things that I think is really important to understand is the impact that the pandemic had on our department, because we are a volunteer-based model. We're probably the only department within Wayne County that actually utilizes volunteers on a daily basis. And I'll speak more about the volunteers later. But it's one of the things that happened is when the pandemic happened, clearly we lost a significant number of volunteers, either because of illness or people simply decided they didn't want to do it anymore. And so a big part of my work on a daily basis, along with the department, is trying to rebuild our volunteer network. We have over 800 or so volunteers currently registered with our department, but not all of them are active. We probably need at least 1,000. So we're really working pretty hard, and a lot of the effort is around that, and we'll talk a little bit more about that as we go. But our goal is to get back to at least 4 days of hot meals delivered. Right now, we deliver hot and cold meals because we don't have, in some of our locations, we don't have enough volunteers. Prior to the pandemic, we delivered 5 hot meals a day. But now we deliver a hot and cold, some combination of hot and cold meals a day, each day, at least 3 hot meals out of the week, because we deliver right now Monday through Thursday.
Commissioner Clemente?
I'll forget if I don't ask. So your volunteers, they use their own vehicles to deliver?
Yes, and they're reimbursed 58.5 cents a mile for when they drive their own vehicle. Now, we do have some communities such as Belleville, for example. They actually allow the city, a city vehicle. So the volunteers actually use a city vehicle to deliver the meals. And then we have a community like Ecorse, for example. They allow their city employees, so they actually deliver for Meals on Wheels. They use their city staff, Ecorse employees to deliver. So those are really the few exceptions. In most cases, it's volunteers using their own vehicles.
Okay, thank you. I appreciate that.
Okay, we can go to the next one, please. So I think one of the things that's really important for those of you who may not realize it is that the U.S. population is aging significantly. As you can see from this slide, the older population grew from 2010 to 2020 at a rate faster than 1880 to 1890. The numbers are about 15.5 million seniors, people that are over, by the government standard, over the age of 65. So we are seeing that this need, this demand for these services are not going to go away. One of the things we're noticing, in addition to the growth in the senior population in the U.S., is we're also seeing the senior poverty rate obviously increase as a result of this growth in the numbers of seniors. It's a great thing because people are living longer, but we also have those who are living longer but are also struggling and will continue to need this service. We can go to the next slide, please. So these are just some stats about it for Michigan itself. If we think about the older population is projected to be nearly twice as large in 2030 as it is in 2000 in Michigan. Right now, Michigan ranks 36th in the U.S. for seniors who are threatened by or experiencing hunger. So I'm painting the scene because we want you to continue to support the work that we're doing. So we really want to show you that there is a need for the work that we're doing, because often being in the human social service sector most of my career, if you are not experiencing some service from that sector, people often aren't aware. If you don't have a child that's in the juvenile justice system or the child welfare system, or if you don't have a senior who is in a nursing home or some other, it's a very unforgotten, right? We don't think very much about these services unless you're experiencing them either yourself or a family member. So we can go to the next slide. Michigan, Southeast Michigan, this data is specifically for Southeast Michigan, and the theme is we're continuing to get older as a population. That's the theme of these slides. But I think that last bullet is a really significant one, to think that by the AARP projects that by 2034, there will be more people over the age of 65 in the United States than there will be people under the age of 18. And it'll be the first time that that's ever occurred in the history of the United States. So clearly, we are aging as a population, which is a very good thing. Clearly, the baby boomer generation is contributing the most significantly to this population. I'm a baby boomer, so baby boomers were 19. I know it ends 1964. I can't remember where it starts, but that's where a big chunk of this population is coming from. You can go to the next slide. So I wanted to share also just some national information about Meals on Wheels, because a lot of people know us more as Meals on Wheels. And this is just some data nationally from Meals on Wheels, which is an organization that is sort of a collaboration of all the Meals on Wheels programs around the country. And the Meals on Wheels programs are operated differently. We're one of the few governments that actually provides Meals on Wheels service. Most Meals on Wheels programs are actually provided by nonprofit organizations. So we're not unique. There are other counties, other government entities throughout the country that do provide Meals on Wheels, but for the most part, it's provided through your nonprofit, public nonprofit or private nonprofit organizations. So, but one of the figures here is that the majority of the participants, at least in 2023, were women. And if you think about 58% had an annual household income of under $20,000 a year. So again, we're really this work is targeting those who are in need and who need this service. We can go to the next slide. Of course, we're also looking at the health and well-being of our seniors, and we can see that a lot of the Meals on Wheels recipients have 6 or more medical conditions that they're dealing with on a daily basis. 30% stayed in a hospital or a nursing home or rehabilitation center in the past month. Again, really wanting you to understand that this program, though it goes under the radar for many, is a very, very useful and necessary program. And I think for those of you who may have attended the State of the County, our CEO indicated that we served 830,000 meals last year. The number is a little higher. It was actually, we just gave them 830. It was actually 833,000 plus meals we served last year. I mean, when you think about it, that is a lot. And how many people know about that? Most people have no clue or idea that Wayne County is involved in this work in helping to provide nutritional services to our seniors. So we can go to the next slide, please. So been here for a year, right? And so the desire is what are our goals? What are we trying to accomplish? And one of the things which we're wanting to do is increase the capacity of the department. Though we served over 5,000 seniors last year, meaning that over 5,000 seniors have received at least one meal from us, that number is higher. We know that the need is higher than that. So, but we have to have the capacity to be able to meet that need as it arises. So one of the things we're really looking at is how do we increase our our operational capacity. How can we be prepared to serve more seniors from all the data I just shared with you? We know they're coming. We know they're out there. So we need to be prepared. The other is, of course, which is what I've been emphasizing in our discussion, is to raise the awareness of our work, to let people know, to tell our story, to let people know what we're out there doing every day, because most people do not know. And so we want to make sure, often when we talk to people, it was sort of like the same thing that happened in the state of the county when our CEO said 830,000 meals annually. Everybody's, ooh, wow, because most people have no idea, right? And so we're really trying to change that. And again, the other is to improve our Department of Operations, because in order for us, again, to meet this need, we have to operate as efficiently and as effectively as possible. So those are our just overall goals that, we're seeking for as we move forward. So we can go to the next one. So how are we doing this? One of the things that we're doing is a lot of the work that I've been able to figure out since I've got here is, well, we're just going to make sure we get meals to seniors. However, we are the Wayne County Department of Senior Services. It is important for us to be at the table for issues that are related to seniors in Wayne County. And so one of the things I'm trying to do is make sure that we are present, that we are not just out delivering our meals and going quietly about that work, but we're also engaged with others who are actively involved in senior activities, senior issues throughout Western Wayne and Downriver communities and Detroit as well. And so I'm out, I'm visiting, I'm engaged, I'm attending events that are involved with seniors. I have a list, I can list them out, but we won't waste your time with that. But I'm also presenting, like to the Rotary clubs and Kiwanis clubs. And I tell people I'll go anywhere and talk to anybody about the work that we're doing. So all I need is to be invited, because again, most of the time, most people aren't aware. I gave a presentation to which I didn't even know existed, but it's the Association of Professional Medical Assistants or something. I'm not getting the name right, but again, I think and again, the reception is always well, and often it's, wow, I had no idea when you talk to people about this work. We're also looking at, we talked about it earlier, department and our need for recruitment. So I wrote out and created a developmental senior services recruitment plan, in which I'll go over a little bit more in detail. But the goal is really, again, to recruit volunteers, because our model relies on volunteers. And at some point, if we don't address the volunteerism issue, we may have to then either have a waiting list or be able to serve less seniors. If we can't get the food to them under this current model, we'll either have to revise the model or we'll have to think about a different way to do this. And the other is to really bring this department as much as we can into the 21st century, right? So making sure that we're involved with email, media, radio. How can we get our message out there? How can we present and speak more about and share with people what we're doing? So you can go to the next slide, please. So how are we doing this? One of the things that we're really trying to do is engage businesses. Businesses adopt roads, lakes, parks. Why can't they adopt a route? Why can't they, I think part of the challenge for me is gaining access to businesses. Obviously, not every business can support this work, but there are businesses who can. And so a big part of our goal over this next year is to really figure out how do we engage businesses and get them involved in and make them aware of how they can support our work. Because even if they can't adopt the route, a business might be able to say, hey, we're going to give a discount on whatever service or product we have to senior volunteers. If you're volunteering for the Meals on Wheels program, you get a 5% discount on your latte or something. I mean, who knows? But there are ways. Also, the other thing that businesses can do is that they can also allow us to have access to the employee network so that we can advertise or promote our need for volunteerism even within their business network, on their intranet or whatever, if they obviously, because we realize our work is done during the work day, during the school day. So we realize not everyone is able to volunteer, but we really want to make sure that we try to encourage people. We're also working to look at how do we diversify our volunteer network by having younger people involved and employed people, as I mentioned, through businesses. So we're actively partnering working with Wayne State University. We've created this initiative called the Ride Along, which I kind of came up with this idea. The goal is to get people to come out one day and just see what it's like to experience delivering meals to a senior and experiencing what we experience on a daily basis. And so we created a ride along. We had a first official ride along with Wayne State back in the early spring or very late winter, and it was successful. We obviously want to continue to do that over. We're also working with colleges and universities. We're going to be working with Schoolcraft College in the fall. They're actually, one of their professors is going to have, in her class, she's going to require her students volunteer as a part of their class, and that'll be part of their class requirement. We're also looking at having conversations with Madonna University and others, because again, schools, we're also working with Wayne State on hopefully being able to have our department designated as a work study site for students. Because again, the beauty of it is if you live in, Trenton, for example, and you attend Wayne State, you could actually volunteer in Trenton, right, in your own community and serve the seniors in your own community. So these are things that we're really trying to do to get people thinking about differently about what's available to them in our department. So colleges and universities is a big part of what we're trying to do to get folks to get involved, because often students have community service requirements. We are proud to say we have our first practicum student from Wayne State working with us right now. She's working at our Garden City and our Livonia sites 3 days a week. And so we're really excited. She's from the public health department. And so again, I say all this because one of the things I say to people is that we need you to be ambassadors for us. We need, the more voices are out there talking about, hey, if you're looking for a way to support your community, if you're looking for a way to give back, have you thought about the Wayne County Senior Services Department? Because again, it's the government. Most people assume that all of our work is done by paid employees. And of course, that is not the case. And the other, of course, is we're working with the faith-based community. I was fortunate enough that our CEO wrote letters sent out to the faith-based community saying, hey, can this guy Chuck come out and speak to you and talk about what their work? So we've been engaged in that project where I've been going out meeting with faith-based leaders throughout Western Wayne and Down River communities, sharing again what we do and what we need in order to do it. So again, a lot of this work right now is about telling the story, getting the message out, and letting people know this is how they can support this project, this work. And we're also, working with other community-based organizations in order to be able to, again, network, partner, collaborate, and find new and different ways that we can serve seniors here in Western Wayne.
Commissioner Clemente?
Thank you, Mr. Chair. So you're right. If you're not walking in the shoes or, because I have referred a lot of people to the Senior Alliance and the Meals on Wheels program. So I'm glad you're taking a proactive approach and trying to engage all these people in volunteer, because we do have you see it like at Gleaners, they have businesses come in and volunteer. But can you have someone just say, I want to volunteer today and put them to work? Or how do they have to go through a process to learn about, or any background checks, or how are you going to do this if someone says I can volunteer only one day? Or
well, that does happen. And yes, you are required to have a background check. So that is the one requirement you're required to have. And if one of the things for us is we don't deliver, a lot of organizations have businesses come in and they have a 1 day where they'll go out and have their volunteer day. Well, that's great. We refer those as ride-alongs, but our goal is we deliver anywhere from 3 to 4 days a week. So we need individuals who can make a commitment, and we try to encourage them to make at least a 3-month commitment. Say, hey, if you can deliver 1 day a week for 3 hours or 2 hours, that's great for us. That's why we're targeting students, because we can say if you can commit to a semester, right, which is typically around 3 months, or if you're a business, you may be able to say we're gonna adopt a route, and we're gonna do one on Mondays. We're gonna deliver on, and we're gonna have a sign up, and we're gonna allow our employees. So it may be a different employee every day. But every Monday, but yet your business could support it by allowing them to come out and deliver for that one day a week. But for us, we do need a commitment. The ride along for us is the one day where we want folks to experience what it's like. And we hope that by sharing in that experience, they'll be able to either go back and say, hey, I really want to do this, or hey, I really want to talk to others about, man, this would be a wonderful thing for you to do, even if they aren't able to do it. Because again, we know everyone isn't able to. So you go to the next slide, please. So one of the things that we're doing is we have this project that we hope to have happen coming up with. I've been having conversations with a company called Civilized Cycles. They make electric bicycles. And we've talked about a collaboration where they would actually, through a grant that they would receive, build a trike that would be an electric trike that we would then use to deliver meals in one of our communities. It would be on a limited basis, probably for a 3 to 6 month period. And so it may not have reached you guys yet, but we've been having conversations back and forth with corporate counsel, because the issue around this is insurance and how do you make sure the vehicle is insured and so forth. There's no cost associated with this but for us, it's an opportunity to do something new and different and to bring attention, because they're a startup company. They're actually building the bikes right here in Detroit. And they're out of New York, but they're actually building the bikes right here in Detroit over at Tech Town, I think, over there. And the goal is it would be great for them because they get to promote their bicycles. And for us, we get to bring positive focus and attention to the Meals on Wheels and to our department and saying, look, we want to engage in looking at how we can do this differently. And of course, obviously, electronic bikes are better for the environment. I got an opportunity to ride one of them, and it is absolutely amazing. I mean, it's really, it pretty much rides itself. I mean, it has a throttle, and anyway, we don't want to get off on all that. But anyway, that's one of the projects that we're really excited about, because again, we want to raise the status of our department. We want people to say, hey, because when people say senior, we know what connotations that has with people. So we're trying to change that. We want people to know that our department is interested in new, fun, engaging ways to fulfill our mission. And so we're really hopeful that this project will happen. We have identified a community in Garden City where we think senior tower residents, and it's like less than a mile from our nutrition site. And we think it would be a great opportunity. We would want to bring out media, get people out, get people to see what we're doing, and get people talking about and being more aware of the work that we're doing. Next slide. I found this on the internet, but this is kind of not what it would look like, but this is kind of the whole, little ice cream truck kind of a thing with the bicycle. That's kind of what it would look like. The meals would be, stored in there. The bike would be, they ride the bike to the site and deliver the meals there. So we can go to the next slide. So when we think about improving our operations, one of the things that we're working on is trying to figure out a way to create. There are mobile apps out there that are used for routing, so that they map out the routes. They give you the most efficient way to go. They allow you to communicate with your volunteers. And so one of the things we're looking at is how do we engage in this? It's a mobile app. It goes on your phone. It's called Serve Tracker, and it allows you to track the meal. It allows you to collect immediate data from the work that we're doing, because one of the things that people aren't aware about is our work is that we're not just delivering the meals, we're also providing a wellness check for each person we see, because we do not drive up like DoorDash and leave the food on your porch. We ring the doorbell, we knock on the door. Someone has to come and receive the meal. If it's not the recipient, it's a family member or someone, because a part of what we do is we get to see and actually understand and know that the person is okay. And for a lot of our folks, we may be the only contact they have with a person that day. And because we don't have enough drivers in certain places, I deliver meals every Thursday, pretty much in Garden City. And I've been doing it since I got to the department, but I've been doing them in Garden City since beginning of the year. And I always tell the story. I've had this one I don't know if she used to be a nun, but she gives me that impression that because she doesn't really speak a lot of English, right? And she has mobility issues. And so every Thursday I come, I knock on the door. She says, come. And she apologizes because she can't get up to get to the door to let me in. But I knock on the door, I walk in, I sit her food down, and she says, thank you. I'm so sorry. But I know I get to see her. I get to know that she's okay. And that's just one example of what happens, thousands of times every week in the work that we do every day. But, she trusts me to just walk in. It's not like I'm a small guy, right? It's like I walk in, but that's the relationships you develop. So, and we also want to move to this digital app because, again, if we want to engage younger people, we want younger people involved. You can't be doing paper and pencil. They're just not going to go for that. So we're also hoping that we can do that. You can go to the next slide, please. The other is that we're working on, again, media. We want to make sure that we're trying to get out and tell our story. I had the opportunity to participate in a Live in the D segment back in November of last year. We have, created, which I'll show, flyers, and we've also done a little social media. We were able to use ARPA funds because, of course, we didn't have any in our book, but we were able to use ARPA funds to create a little media, a video, a 15-second video, which we're going to show. Are we able to open the link to the Engagement HQ? The other thing that we've been able to do is we are one of the first departments to actually engage in the Engagement HQ, which is a project which for us allows us to communicate and receive direct feedback from our volunteers. It's designed to really address and meet and touch and give volunteers an opportunity to talk and engage with each other. So it has, Wayne County Meals on Wheels volunteers, the heart of our community, because clearly we can't do this without them. But this site allows volunteers to register and sign up. We have thank you letters from which I'll share some of those with you. We have pictures, we have quizzes and questions, but it allows us, and we've just launched it, so we're really working to get it up and running. But it's an opportunity for people to engage with our department in a different way and actually give the volunteers an opportunity to give us feedback and share information with us and share stories with us. So I wanted to share that. That's something that was just launched like last week. And we encourage our volunteers to sign up and participate. And there's pictures, of course, you can see from the various activities and things that we've been involved in. So if we can go back to the presentation. Thank you. So if we can go to the next slide, please. So we've been talking a lot about volunteers. They are clearly the heart and soul of our work. It's not a lot more I can say other than if you know of anyone who might be interested in volunteering, please steer them our way. If they're interested in just a ride along where they want to come out and experience it for a day so that they can know what it's like. But this is clearly, they are clearly the key. We have 8 full-time employees, approximately 60 part-time employees, but yet we have well over 800 registered volunteers for our department, and that's not enough. So as you can see, they are clearly the heart of our work. Go to the next slide, please. So this is a video, I think you can click, this is the video. We worked with a company called King Media to create this video that we really like. And this, right now, it's being run because in just different places. We weren't able to purchase time, like prime time, but whenever there's an open spot in certain places, like even at a couple of movie theaters, this video is shown. It's only 15 seconds, so if you can show it. See if you guys are able to. Yes, can it started from the beginning.
Mhm.
Best part isn't the meatloaf or the mashed potatoes. No, the best part of the meals you deliver for Meals on Wheels is you. Be the best part. Volunteer today at waynecountymeals.org.
So that it's a short, but it
Yeah.
really is, we love it. We think it really gets right to the heart of the work. And so we're hoping to expand viewership and try to figure out how we can get the video in front of more people. So we can go to the next slide, but again, that's something that's different, something that really hasn't been done. So the last thing I wanted to do is talk a bit about, where does our department sit within this idea of the senior well-being ecosystem. Again, when we think about ecosystem, we think about the interconnectedness of either, usually it's plants and microbes and so forth when you're talking about a biological ecosystem. But when you talk about a human ecosystem, you're really talking about interconnected services, people, with the whole goal of being able to ensure that the well-being of our seniors is being addressed in whatever ways and whatever that we as a county and as a department are able to do. Can we go to the next slide? So, what we're trying to do is figure out where our work sits, right? And so these are questions, are we working with those in the midst of the senior well-being? Are we creating dialogue? Are we really, we want our department to be more than just a Meals on Wheels department. We want our work to be engaged with the, we want to be at the table. We want to be really a part of that idea of we're contributing in whatever ways to the well-being of seniors. And it's not that we have to do all the services, right? Or, that's not the goal. The goal is to make sure that we're connected and connecting, and that we're engaging, and that we're really a part of the discussion. We want people to know that we care about our seniors, and we're doing our very best in the work that we do, but also in the work to collaborate and partner with others to ensure that seniors in Wayne County are as well as they can be. So next slide, please. So these are a few we get tons of thank you cards and letters from our seniors. So I wanted to share a few with you. And these are actual letters written as they came to us. I brought one just in case you didn't believe me. So here's an actual letter. So, but if you can see, thank you so much for the delicious food. At 94 years of age, I don't get out much without help. Can't afford a fall. Bless you and all you do. Is that this one? Yep, that's this one. So this is the actual card. So this is another. Thank you very much for the meals and also the nice people delivering. Thank you for the meals. So, and this was to all the volunteers at Meals on Wheels. Thank you for your service. I appreciate all your hard work, all you do. May God bless each and every one of you for your kindness. You know, great job. We have, you know, we get tons of these actual letters every day from real people who receive the services that we provide. This is our flyer. I brought some with me, so you can take some flyers with you. These are our flyers for recruitment. You know, Wayne County needs Meals on Wheels volunteers. And then the last slide is the number that if anyone's interested in signing up for meals or being a volunteer, this is the number they will call. So thank you. I appreciate you taking the time and letting me share with you a little bit about our department's work. Any questions?
Yeah, thank you, Dr. Jackson. Commissioner Clemente?
Thank you, Mr. Chair. Do you have a way you can send that flyer to us to put on social media?
Yes.
Thank you.
Excellent. Commissioner Colleen?
Thank you, Mr. Chair. Morning, Mr. Jackson. Actually, the whole PowerPoint, if you could send it, there's good data in there.
Well, you already have it, I think, because I sent it
Did I?
to, yeah,
We can send it out.
yeah, I sent it to,
Send it out.
yeah.
Was it with the agenda? I'll find it. Anyway,
Yeah.
so the Senior Alliance funds Meals on Wheels, correct?
They fund part of it, yes. The general fund also funds part of it.
Okay, how much, what's the ratio there?
The bulk of the funding comes from the Senior Alliance. It's the total amount for this year. I got the numbers here, but then I have to find my glasses to get the actual numbers. Is something like 2 point something million. And I think general fund is about 900,000. So
Okay.
the bulk of the funding comes
Two to
from the
one,
Senior
yeah.
Alliance.
And your presentation was all about Meals on Wheels. I would assume because we get and you can confirm or deny, since we get the Senior Alliance funding, that's why we're not working in DAAA territory.
It is because, yeah, the county is divided. It's
Right,
the
right.
only county in the state that has 2 AAAs,
Yeah.
right? Which is, and so Detroit, the Detroit area agency supports all of Detroit and the communities I mentioned earlier. So that's that they provide the Meals on Wheels themselves in Detroit.
So what senior services do we provide beyond Meals on Wheels?
At this point, that's the only service we
Yeah.
provide.
Because I saw, you were talking about advocate for senior well-being, and you had a few bullet points under capacity, but your capacity right now is just basically for departmental operations, doing better what we're doing now.
Correct.
And you and I are both members of it. This big senior bulge that's coming for America is going to present a lot of difficulties, federal, state, local, to handle that. And as you're saying that, it just reminded me, I think the average age in Gaza is something like 28. And in a lot of places in the Middle East, Iraq, Iran, very young populations. Here we are with an aging and birth rates declining. So what is on your radar for what else? Because we do have the 2 senior agencies in the county. Well, where is there room for Wayne County seniors and veterans to perhaps provide some service that's not being provided now for seniors? What do you see to go into? What else do we need to do for this well-being? And keeping people at home is now and will continue to be the thing.
Well, I think one of the things is, being in the human social service sector for a long time, there's often this idea that you have to do everything. I think
Right.
that's not my mindset. My mindset is, how do you ensure that those who need services, because there's tons of stuff already out there available. The real challenge for many of our seniors is how to connect them and not just make a referral, so often, people just, oh, I made a referral. But if my mom is 82. My mom lives with me. She's 82 years old. And if I just said, hey, Ma, here's a referral to X, it would never happen because she has no way to navigate these systems. So a big part of what I've been talking about, and at some point, is how do we actually create means or mechanisms that would allow us to actually hold people's hands, right? To ensure that not just you making a referral, but that there's someone available to actually ensure that or help or assist them. Because sometimes there's family members available, obviously, but sometimes there aren't. So, but I think for us right now, we have to think about how do we first ensure we can meet the capacity, the demand that I think is coming for us in this area of service we provide. But more importantly, for example, we're a part of the Senior Regional Collaborative. Our department is a member, and that organization is comprised of dozens of organizations that are all addressing the needs of seniors in some variety of different ways. And so we work very closely with the collaborative to partner, collaborate, share information to make sure that we're really talking about what are some of the challenges, the hotspots. But for me, a big challenge for us is we have to move beyond I've done something for someone because I've made a referral. So as I think about where we may be able to go as a department in the future, that's the area that I'm most interested in trying to pursue is how do we bridge that gap between referral and actually ensuring someone gets.
And does that come up in conversations in the collaborative? Like
Yes.
we need,
I bring it up. I mean,
Yeah.
I'm not the only one, of course, but yeah, that is one of those. That to me is the most real.
has that
issue.
led us anywhere?
No,
Has
it's.
that, yeah. Because, it is almost all nonprofits in this area
Mhm.
and everybody's chasing grant dollars. And then you can be a little, I'll use the word selfish, right? Because I want those grant dollars. I don't want somebody else getting those grant dollars, that kind of thing. And that was another question I had is sitting with everybody else that's doing this work. If there is something where there is a role for us to provide this work, and because it's going to be more critical all the time, and we're going to be dealing with this in so many ways throughout government with an aging population. So good luck with the collaborative. What do you see as the needs that jump out at you right now that aren't being satisfied right now for seniors in Wayne County?
Well, I can really only focus because I don't have any choice on our department. And when I think about our department, it's the need for volunteerism.
Yeah.
That's the number one issue for us right now as a
But
department.
when we talk about senior well-being,
when we talk about in order for us to continue to provide the nutrition services we provide, which is certainly contributing to senior well-being, we have to have enough volunteers. So
no, I feel you, and I feel the funding, but it does seem to me there needs to be more with all the professionals from the different groups in the room to say, okay, what's the best way to do this? What are we missing? Right? How do we get that accomplished? More and more seniors are wanting to stay in their home.
yes.
Less expensive and better outcomes for people when they do that. So right now we don't see beyond shoring up the Meals on Wheels. And by the way, we don't have a waiting list, do we?
No.
So it's not like there's an additional 1,500 seniors out there that if we had more funding, we could bring them on.
That is correct.
Yeah. Everybody that needs to get a meal is getting one right now.
That is aware that they're available, that they have because I think part of the other issue, the more we promote the department, the more we get calls for people saying, "Oh, I didn't realize I was eligible," or "I have a friend or a family member." So it's really the more we generate, awareness, the more people are saying, "Hey, I'm eligible."
Yeah,
And so I think that's the other side of it. And so we're trying to balance the two out.
I gotcha. Okay, thank you for the report.
Thank you.
Thank you, Mr. Chair.
Thank you, Commissioner. Thank you, Dr. Jackson. One of the things that stood out to me too, and this past Easter, I was able to go and volunteer with our Meals on Wheels program at Maplewood Senior Center in Taylor, and it was a very, very awesome experience. The person I rode with, he's been doing it for many years, and he dressed up even in an Easter costume and everything else. So it was nice. And like you mentioned earlier, this is probably one of the only interactions that our seniors get during their day, and they look forward to it. And you can tell that when you see and visit them. So it's such an amazing program, and just great work to all of you and your volunteers on what you do every day for the county. So thank you.
Thank you.
Any other questions or comments for Dr. Jackson? Thank you, Doctor.
I'll just.
Yeah,
comment
go
real
ahead, Commissioner.
Meals on Wheels for seniors. Quite often, that's the only person they see all week. And those conversations with seniors are precious
Yes.
when you show up with a meal and talk with them. But yeah, I mean, that's for a lot of seniors about their only human contact.
Absolutely. Absolutely. Commissioner Clementi?
And I think, thank you, Mr. Chair. I think you brought up a good point that also you do holiday meals too with the Senior Alliance. And that is another place that people are lonely. And so, yeah, I actually was just looking through my photos and I have one of my volunteers from Lincoln Park. So I think we need to find more. There are people that are out there that could volunteer, and I think we just need to get them to do it. So it'd be great. Thank you.
Thank you. Thank you.
I think I'm on the next agenda item.
Absolutely. Madam Clerk, next item.
Item 2, requesting commission approval of Amendment 1 to a 3-year agreement with the Senior Alliance to continue providing congregate home-delivered liquid and halal meals to eligible senior citizens in 34 communities of the Western Wayne County and downriver areas.
Thank you, Dr. Jackson.
Well, as you know, our funding comes through the Senior Alliance, it's federal and state funding, and our budget is based on an estimate of, from the previous year, what funding we think we're available. But by the time our budget is approved, the funding process has not completed its cycle. So through the Senior Alliance and the federal government, often they receive more funding than they had initially projected. And that is the case here, where they've received an additional funding, and that funding has been allocated to congregate and home delivered meals. And they're basically giving us more money to help serve our communities.
Excellent. Any comments, questions from commissioners?
Approval of this item, Mr. Chair.
Excellent.
I'll support.
All right, moved by Commissioner Colleen, supported by Commissioner Clementi. Roll call for the item, please.
Commissioner Colleen?
Aye.
Commissioner Clementi?
Yes.
Commissioner Garza?
Yes.
Motion carried.
All right. Thank
Thank
you,
you.
Dr. Jackson. All right. Next item.
F, such other matters as may be properly submitted before the committee.
There are none. Next item, please.
G, public comments.
All right, we will move to public comment portion of the meeting. Are there any public comments via Zoom or email?
No emails were received and no one on Zoom.
Okay, there are no one on Zoom, no emails, so we'll move to public comment in this chamber. Any interested parties for public comment today in the chamber? Okay, going once, twice. All right, we will close public comment. Next item.
Adjournment.
I'll entertain a motion to adjourn. All right, we moved for adjournment of Commissioner Clementi, supported by Commissioner Colleen. Do we need roll call? No, I think, or all in favor, please say aye.
Aye.
All right, we are adjourned at 10:28.